What are some of the drug treatments that you prefer to use?
Sometime, depending upon the condition of the patient, you need to give them some non-steroidal anti-inflammatory medication. However, I don't want to be prolonged for a long time because they affect different systems of the body. You see, when we are treating the patients, first thing in medicine is do no harm. And sometimes the harm is very occult, very subtle, and it is accumulative. It's very important that we tell people that look, this medication are for a few days. And then there are many other different kinds of medications which I use sparingly, especially the narcotics. Because what the narcotic does, it kind of blunts the pain perception. It doesn't do anything, narcotic medication. It doesn't do anything with the real problem the person is having. So I want my patients to be conscious. That is the spiritual part. I don't want them to be more unconscious, more unaware of their surroundings. But however, sometimes you have to use that to break the pain cycle. Pain actually moves in cycles. Pain causes more. Basically, the pain that goes in cycles. So pain causes more pain. It's because the nerves become hypersensitive. If somebody is having continuous firing of those nerves become hypersensitive. So that's a very important point in the history of that patient. If we don't effectively, significantly break that pain cycle, that is the person is going to turn into chronic inflammation. So how we are going to break that pain cycle? Sometimes we use non-steroidal and sometimes sparingly, with judicious acumen, we want to use those narcotics. So very judicious use of narcotics sometimes helps to break the pain cycle. But it's not for everyone. Some people actually they don't really get advantage of those narcotics. They get addicted to it. So the addiction comes in. Now we are not solving the problem. Actually, the solution of the problem becomes the problem. And that's what right now the medical sciences and all the state agencies, the government, they are worried about it because people are coming to ER with overdoses of drugs. So something that can effectively break that pain cycle is fine. Corridor fluid, cervical joints, other tissues. So we do those. As a matter of fact, I do all kinds of cervical, thoracic, lumbar, and these are the different parts of the spine. And all joints, even the tiniest joints. I don't remember any structure outside in the body where I have not put my needle in. However, even this modality has to be used sparingly. We see the millions of injections are being done, and naturally, one needs training, one needs expertise in many things when we talk about injections. As a matter of fact, it's kind of a surgical procedure in one way that we do all the measures, the safety measures, as if we are doing in some surgery, because the side effects from those injections could be devastating if all those things are not taken into consideration.